At Rejuv Medical, we perform a slow motion video analysis of your throwing motion to help identify faults that are contributing to your pain. During your throwing evaluation, we break down your mechanics frame by frame in order to look at each of the throwing phases. Mechanical faults are identified and reviewed with you, and you're taught throwing drills to help correct these errors to help you return to pain-free throwing and improve your performance. The throwing motion can be broken down into 6 phases: the windup, stride, arm cocking, acceleration, deceleration, and follow-through. The arm cocking phase can be split into early and late arm cocking as well. We'll briefly discuss each of the throwing phases. During the windup phase, the athlete initiates the movement with their legs, and this phase ends when the thrower reaches their balance point on one leg, when the knee reaches its maximum height. This windup will look different between pitchers and position players. The next phase, the stride phase, starts with movement towards the target. The arms perform a handbrake where the path of the ball goes down, back, and up. This piece is critical as the timing between the arms and the legs are imperative. When the foot makes contact with the ground, the arm should be in a semi-cocked position. The stride foot should land almost directly in front of the body with the toes slightly turned in. Throwing velocity and power comes from a combination of upper extremity, trunk, and lower extremity movements. We can't forget about what the lower extremity is doing during throwing, because it is the main force generator during throwing. The third phase is called arm cocking. This phase begins after foot contact when the trunk and hips rotate as the arm externally rotates, and is completed when the arm reaches the maximum amount of external rotation. During the act of throwing, the arm moves through extreme ranges of motion, and it needs a stable base to effectively perform. This stable base is the shoulder blade, and proper strength and muscle control is vital. During this phase, we also want to look at the arm slot, or where the arm is in relation to the body. Arm acceleration is the fourth phase, and this is the time between maximal shoulder external rotation and when the ball is finally released. Movement continues at the trunk and the pelvis, and energy is transferred from these areas through the upper extremity. The elbow is near full extension at ball release. Good core and lower extremity strength is required to maintain a stable base. The fifth phase, arm deceleration, is the time between ball release and maximum shoulder internal rotation and elbow extension. This is the most demanding time for the muscles and ligaments during throwing, as they are trying to slow down the speed of your arm. During the last phase, the follow-through phase, the arm and body continues to move, and the throwing motion ends when the athlete gets into their fielding position. We go through this video analysis with the patient to determine what faults are present and teach them throwing drills to correct these. In addition to throwing drills, the athlete should already be performing a good rotator cuff and scapular strengthening program that is essential for injury prevention. Become a more efficient, pain-free thrower with a video analysis performed at Rejuv Medical.